Baby Yum Yum. You can't parent without it.
Thank you for listening to this podcast. I'm Paul Rotherham. Baby Yum Yum was founded by Amanda Rogaley, and this series of short interviews with her is designed to answer the many questions we've received regarding COVID-19 and parenting. We hope to address all your concerns and cover the many stigmas surrounding this virus as you continue to enjoy our content here on your number one parenting portal, Baby Yum Yum. In this episode, we're talking about pregnancy. If we are planning to have a baby and considering falling pregnant, should we perhaps think about delaying this?
I'm just a mom, so we've obviously curated information from our expert gynecologist, and she's given us information that she sourced based on research. So one of the first questions that came up was, are there any specific risks or increased risks for pregnant women? And the fact has come back is that based on the studies, there is no direct report based on whether you are pregnant or not, whether you have an increased risk. Bearing in mind that women who are pregnant sometimes do have a decreased immune system, which therefore could result in them getting the COVID-19 virus.
Are there extra precautions, simple steps that we can take if we are pregnant?
I think you need to stick to the general guidelines that the rest of the population uses. Avoid people who have symptoms of COVID-19, avoid public transport, work from home, avoid large gatherings, avoid gatherings with family and friends. You never know where they have been. Don't touch people, and rather use a telephone or online services to contact your GP or healthcare provider. And again, most important, hand wash, use sanitizer, and if you are going to cough into your elbow. Don't cough and splatter all over, and avoid touching your eyes and nose and mouth with unwashed hands.
As far as we know, can COVID-19 increase the risks of miscarriage for someone who's pregnant?
There's currently no data suggesting the increased risk of miscarriage or early loss in relation to COVID-19.
And can the virus, as far as we know at the moment, can the virus be passed on to the newborn?
At this point in time, there have been 2 cases of possible, and I stress the word possible, vertical transmission between the mother and the child, but it remains unclear at this stage whether the transmission was prior to or soon after the birth of the child. So they haven't been able to reach a conclusion whether the transmission was done while the baby was in utero or whether the transmission occurred once the baby was born. And in fact, even if it was from the mother or from possibly a healthcare worker that came into contact with the baby once it was born.
We say breast is always best when it comes to feeding. Do we know whether this is impacting on breastfeeding at this stage?
In 6 Chinese cases tested, breast milk was negative for COVID-19. However, though, saying that, given the small number of cases, it's always best then to breastfeed with caution. But the main risk for infants of breastfeeding is the close contact with the mother rather than the breast milk. We advise that the benefits of breastfeeding outweigh any potential risks of transmission. So it's rather better then to hold your baby close and breastfeed them because the benefits of that outweigh the risk of the transmission.
So for moms now or moms-to-be who are pregnant and now suspect they have the virus, what's your advice there, Amanda?
I suggest that immediately you contact your healthcare provider, ask for guidance, try and get the correct testing done if you feel that you are in fact potentially infected, and go into self-isolation and take care and do the correct management if you have the potential infection. If you are unsure, it's always best to contact your medical practitioner or contact the COVID-19 hotline on 0800 029 999.
That was Amanda Rogaley, Chief Mommy and founder of Baby Yum Yum, the fastest growing parenting community in SA.